Okay, so next we're going to talk about the newborn. So once the baby is born, we have been able to, believe it or not, study kids that are this small with some pretty interesting research techniques. They used to think that a baby was not really taking in any information, and now they know that that is not the case. The newborn baby can sense things, they can learn things, they can remember things. They're a lot more sophisticated than we originally thought. So a couple of the techniques they use to determine this is, one is the habituation technique. So they might show an infant a pattern and they'll take note of where she is looking. And when she kind of stops looking at the pattern and starts looking at other things, then she's habituated to it. She has become less responsive to it. Okay. Another way they do this is with eye tracking. So if they show an infant two different stimuli, they can look and see which one she's looking at more to see which one she likes better. So they have to look at her eye movements. Another one is sucking rates. If you have a pacifier hooked up to a device that records how quickly or slowly she sucks, that can also give you information about what stimuli she prefers and what stimuli she doesn't. Okay. What about reflexes? Do babies have reflexes? And the answer is yes, they do. So reflexes are unlearned reactions to certain types of stimulation. And these are pretty much wired in, that it's just an automatic response. You don't have to learn it. It should already be there. So the reflexes that the infant has is the sucking reflex. So if you put a nipple in their mouth, they're going to suck. Obviously, that would be important so that they can feed appropriately. Swallowing is when there's liquid in the mouth, they're going to swallow. Grasping. Have you ever taken your finger and let an infant grab onto your finger? They actually have a pretty strong grasp reflex. And there's a picture in your text that shows a woman holding up an infant by her two fingers. Oh my gosh, I'm so bad at this. And now I would not recommend that at home. I don't think you should try that, but it is pretty amazing. The rooting reflex, if you touch an infant on the cheek, they're going to turn toward that touch, and that would be to help them feed. And then the moral reflex, have you ever been holding a baby and maybe kind of drop them a little bit quickly? What they do is they fling out their arms. And so, I don't really know that that would help them that much, but it is a reflex they have. If they feel themselves dropping, they'll fling out their arms. That's called the Moro reflex. All right, what about sensory capabilities? Infants can do a lot at a young age that we didn't originally think they could do. So vision, let me put these all up there. So at birth, a baby is pretty nearsighted, and they see best at about 8 inches away. So pretty much, if someone's holding them up and looking at them or talking to them, that would work out to usually be around 8 inches. They really like bold prints and black and white contrast and patterns. And this was with some of those techniques we talked about earlier. They seem to prefer face-like stimuli. But the question is this just a preference for complex stimuli, or is it really a face pattern? And we're going to answer that question in just a second. Another thing infants are good at is mimicking gestures or facial expressions. So if you're holding a baby and you look at their face and you make a movement with your face, like open your mouth or stick out your tongue, lots of times they'll imitate you. So that seems to kind of be pre-wired as well. All right, so here is, my goodness, you hear the ice maker in the background. Here is a couple results of a couple experiments that were looking at this whole face question. So in this top one, the face stimulus and another complex stimulus are both preferred quite a bit, but they do seem to prefer the face stimulus more. But this one on the bottom really answers the question. So here they took the same shapes and put them in this stimulus, and at least according to their eye movements, they actually liked the face stimulus better. So it seems that we're kind of pre-wired to prefer faces. All right, what about hearing? So infants are very sensitive to sounds that have kind of a high pitch. They definitely pay attention to voices, songs, melodies. And because they've spent all this time in the womb listening to their mom and probably their dad too, they usually can pick out their mom's voice, or they seem to prefer their mom's voice to other women's voices, their dad's voice to other men's voices. They have shown to be able to tell the difference between similar notes if you play them and similar speech sounds. So again, they really have a lot more capabilities than we used to give them credit for. Another thing that infants like to do is to listen to the type of speech that we tend to use with them. We tend to kind of slow down what we're saying, talk in a higher pitch, might even have like a sing-song quality to it. And we do that just naturally, and infants respond to that really well. It helps them to learn aspects of speech. All right, what about early learning and memory? So it has been shown that infants remember certain aspects of their experience in the womb, so like their mother's voice, their father's voice, other things like that. Like if you play them a song a lot in the womb, they'll be able to kind of pick that out. There is a researcher that has done some really fascinating studies with infants, and her last name is Rove Collier, and she wanted to see what infants could learn even early on. So she took 6-week-old infants, put them in a crib, and then she attached a mobile, that hangs over the crib that they can look at, to one of their ankles with a ribbon. And the child would learn that if they kicked their leg, the mobile would move, okay? So they had this experience. Then the parent brought them back 2 weeks later, and they would see if the baby would remember. And most of the time, the baby would kick whatever leg had been attached to the ribbon and the mobile more than the other leg. Well, Rove Collier was wondering if she could influence how long they remembered this experience. So in one set of experiments, you know the crib liners, those things that you put in to line the crib, and they often have a cute design on them, maybe animals or something like that. So she would take these infants and put them with the same crib liner they had before or with a different crib liner. And she found that if she used the same crib liner, then they actually remembered this experience even longer, even up to another couple of weeks. So these are really interesting studies, and again, they changed kind of how we thought about infants' capabilities. All right, so something else that we learned fairly recently was that the brain develops in certain ways after birth. So when a child is born, their brain has all the neurons that it will ever have, but it's lacking a lot of the synapses, the connections between the neurons, okay? So during that first year of life, there's a whole bunch of synaptic connections that are formed, okay? Connections are formed between neurons. And over the first several years, the brain kind of follows the use it or lose it. So if you use connections, if you use certain neural circuits over and over, those pathways are strengthened. If you don't use certain synapses over and over, those pathways are weakened and they might go away altogether. And that's what's meant by pruning. So if we're using certain connections, those are kept. If we're not using certain connections, those are lost, okay? And how the brain matures is also correlated with how psychological development goes on. We do a lot of psychological development in those early years of life. And that's what we're going to talk about next. Okay. So motor development, generally kids will learn certain things in a certain order. But how quickly they learn those things depends. So for instance, my son did not learn how to walk until he was 15 months of age. That's on the late side. My daughters, my twin daughters, they both were walking by 12 months, okay? So that was different. However, all my kids kind of learned things in a certain order. So they would learn how to lift up their head, then they would learn how to sit up on their own. Then they would start to crawl and eventually, then they would pull up on things like a table, and then they would start to walk. So that sequence was the same, but how quickly this occurred was different. And what's fascinating is this can be affected by cultural factors and the physical environment. So in certain cultures, babies are strapped to their parents' tummy or back and carried around for the first few months, and those children are going to tend to walk later than kids that are in an environment where they're encouraged to sit up on their own and move and so on.